In January, I had an accident with a fire and a gas can exploded on me, and I was burned on 83% of my body. I was at VCU for 9 or 10 months, and after I was able to come here.
So Kody had pretty extensive burns, and the general approach to someone who has had large burns, there's a lot of different directions we look at. There's a lot of things that can potentially go on in the acute care hospital that we then have to figure out how to manage. So there's severe burn issues very often, and very often there's a lot of psychological trauma as well. So those are all the factors that we're taking into account.
I would wake up in the morning and OT would come in, Lisa would come in, and we would do a bunch of like scar massage to get the scars down. We would do a bunch of picking up blocks and stretching across your body, or handing them over, or just a bunch of reaching stuff to get your motion back.
When we're talking about burns, most often the biggest limiting factor long term, usually even after going home, is the lack of range of motion. And so when you have lack of range of motion, especially imagine if it's your arms, you might not be able to get your hand to your mouth in order to feed yourself, to brush your hair, to shower. In our situation, it's usually more occupational therapy due to the activities of daily living being the hardest thing to accomplish.
I had physical therapy in the afternoons, and there we would do various squats and kicks and steps and just transfers, practice getting up and down from different surfaces. We worked on the stairs. That was a pretty big goal, so that was cool to accomplish that. And then go over to the actual staircase and do that. I can walk a pretty far distance now compared to at the hospital. I started out just walking laps in my room for a couple feet at a time. And then when we got here, we would walk around the courtyard or walk around the building. Thought that was pretty cool. We would have therapeutic recreation some days where you would go play games or just leisurely activities.
One of the purposes for coming to rehab is to try to gain some of that range of motion back, but a lot of that isn't going to happen in the short time period we have here. Our goals here are to get someone home safely and such that they can continue to progress. And so the things that we focus on is there's a lot of family education and figuring out what sort of things have to be accomplished in this setting for it to be a safe transition to home, and what family's capable of doing. And then the other aspect is trying to manage some of those other symptoms, such as the pain, trying to make sure nutrition's adequate, trying to make sure that there's the appropriate adaptive equipment in order to maximize their independence when going home.
The therapists, they are great. They're awesome. They just made you feel like family. You talk like everything is just like you've known each other for years. Everything is top of the line here. Stuff I've never even imagined before, the tools that help you get better. That's pretty eye-opening. They are gonna push you, but it's all for the better.